Hi, welcome to your first day on Psychiatric unit. I'm grateful you are here today. So before we see any patient today or together, I want to take a few minutes to walk you through the psychiatric assessment. Even though you already have a strong medical foundation, a psychiatric assessment and areas that are unique to mental health practice, and understanding them will help you feel confident as we move through the day. So for that reason, we have elements of psychiatric assessment I want to go through with you before we visit our patient. First, a psychiatric assessment is a structure, comprehensive foundation or evaluation of patient emotional, cognitive, behavioral, and social functioning. It helps us understand not only that what the patient is experiencing, but also how these experiences affect the daily life. So there are so many major components, including the system that I wanna start explaining to you one at a time, so that you may understand what we are up to. First, we have chief component. We always start with the patient own wants about why they are seeking care. This anchors the assessment in their life experience, and also it helps us to know where we're gonna start it. The other one is the history of present illness. You want to understand or to explore the onset, duration, severity, and progression of symptoms. We ask about trigger, stretches, and how the symptoms impact sleep, appetite, mood, concentration, and functioning. And so this section is central to identifying patterns and ruling out medical causes. Past history of psychiatric is also important. It's part of the element that we need to look at. And this is the previous diagnosis of the patient, hospitalization. You want to know the medical trials and the responses, whether the medication they were on, they were effective or not, suicidal attempts and self-harm. This is also where you want to know about the prior therapy or counseling meeting or session they had in the future, and this history help us understand what has or has not worked for the patient in the past. Also, we have medical and substance use history. You find some patients, they do have those history because medical condition and substance can mimic or worsen psychiatric symptom. We always review chronic illness, neurological condition, also medication, allergies, and substance use. Once you get that information to help you understand and combine all this before you give diagnosis. And so we also have the family psychiatric history. In mental health condition often have genetic components, so we ask about family pattern of mood disorders, psychosis, and substance use or suicide. We also want to understand the patient's social and developmental history. In this case or situation, this include childhood experiences, education, employment, relationships, trauma history, culture identity, and spiritual belief. These factors shape how symptoms develop and how patients cope. We do have also mental status examination, and in this situation, the MSE is our objective snapshot of the patient current functioning. This one, it's include appearance and behavior, the speech, mood and affect, and thought process and content. And also we have perception, we have cognition, and insight and judgment. So we don't want to also forget about the risk assessment. We always assess for suicide risk, homicide risk, self-neglect, and vulnerability. Safety here is our first priority. And so we need to check on that very seriously. So the clinical interview is the heart of psychiatric system or assessment. It is where we build rapport, establishing trust, and creating a safe space for the patient so that they can share their story comfortably, and making them to feel that somebody understands them, somebody can hear them, somebody is there for them. And so we have the techniques core for this interview that help us to understand more and to deeply and get the real priority information that we really need. First of all, we need to consider the techniques of open-ended questions. We need to actively listen to the patient, reflective statements, clarification and summarizing, because you have to clarify what they said is what you understood. And also, after you receive all those information you are looking for, it's good to read or to restate back to the patient by summarizing what you understood to them, so that they say, yes, that's what I meant, or no, this is not what it was, it is this, because miscommunication can happen during that time. So clarification and summarizing here is very important. You don't want to show them sympathy, but you want to apply empathic validation, and you need to understand the patient's situation without judgment. Culture, humility. You need to understand their culture. There are some people, they don't want you to look at them when they are talking, or there are some people, they don't appreciate you talk to them while you are looking face to face to them, or there are some people, they don't want you touch them when you're talking to them. There are some who they feel comfortable with you when you're holding their hands when the time of emotion comes in. So all this culture, humility is very important to consider here, so that you get appropriate information you are looking after. So these techniques help patients feel heard and respected, which increases the accuracy of the information we gather. When we are interviewing adults versus children and adolescents, this is a very tricky area. And when we are interviewing adults typically provide their own history. The interview is more direct, insight-focused, and structured. Adults can usually describe internal state, thought patterns, and coping strategies. Interviewing children and adolescents with young patients, the approach shifts significantly or slightly. It just you have to consider some key. And the key differences here is the developmental level guide, guides the interview. Also, caregivers provide additional curricular information, pre-basic or activity-based techniques that may be used with young children. And so symptoms often present behaviorally rather than verbally. So, for example, a child may show depression through irritability or school refusal, while adolescents minimize symptoms due to fear of judgment. Our job is to meet them where they are developmentally. There's also things to consider, like role of psychiatric assessment in diagnosis. The psychiatric assessment is fundamental of diagnosis. Unlike other specialists, where labs or imaging confirm a condition, psychiatry relies heavily on clinical evaluation. And so the assessments help us to identify the symptom patterns, determine severity and functional impairment, also rule out medical or substance-related cases or causes, understanding psychosocial contributors, and also match finding to DSM-5 TR diagnostic criteria. So by saying that, we should understand diagnosis is never based on a single symptom or a single moment. It is a synthesis of patient history, current presentation, risk factor, and contents. Although assessment ensures that we provide accuracy, patient-centered care, remember, the first priority is the safety of this patient. And so, as we go into today's clinical experience, me and you, remember that psychiatric assessment is both art and science. It requires structure, curiosity, empathy, and culture awareness. You will see how all of these components come together as we meet our patient today, and I will guide you through each step along the way. Unless you have a question, I think it's time for us to go. Thank you. Yes, it seems you don't have a question right now. Let's go and visit our patient. Thank you.